In the smoke-blackened industrial town of Blackburn, Lancashire, during the harsh winter of 1848, a discovery would emerge from the depths of human tragedy that would challenge everything Victorian medicine understood about pregnancy, death, and the body's capacity for preservation. When Elizabeth Hartley died of typhoid fever at the age of 32, her final whispered words were a question about the baby she had never delivered, a child she had carried for 4 years in a state that defied medical explanation. What the autopsy revealed was a lithopedion, a stone baby, a fully formed fetus that had been gradually encased in calcium deposits within her abdomen, transformed by her own body into a grotesque fossil of maternal hope and biological desperation. The England of 1848 was a nation in the throes of industrial transformation, where the rhythmic clatter of steam-powered machinery had replaced the seasonal cycles of agricultural life. Lancashire, the heart of the cotton industry, epitomized this new world of factories and mill towns where entire communities existed to serve the insatiable appetite of textile production. Blackburn, with its forest of smoking chimneys and maze of red brick mills, housed over 50,000 souls who lived and worked in conditions that would have horrified their rural ancestors. The town's landscape was dominated by the imposing structures of cotton mills, their tall windows designed to capture every available ray of sunlight for the delicate work of spinning and weaving. The air was thick with cotton fibers and coal smoke, creating a perpetual haze that turned white clothing grey within hours and left a metallic taste in the mouths of all who breathed it. The River Blakewater, once clear and swift, now ran brown with industrial waste, its banks lined with the detritus of progress. Working-class housing in Blackburn consisted of rows of terraced cottages built hastily to accommodate the influx of workers drawn by the promise of steady employment. These homes, constructed of cheap brick and mortar, were cramped and poorly ventilated, with entire families often crowded into single rooms. Sanitation was primitive, with shared privies serving multiple households and water drawn from communal pumps that were frequently contaminated by industrial runoff. Medical care for the working poor was rudimentary at best. The town's single hospital, a charitable institution funded by mill owners seeking to maintain a healthy workforce, was chronically overcrowded and understaffed. Most workers relied on folk remedies, patent medicines, and the services of local midwives and bone setters whose knowledge came from experience rather than formal training. Pregnancy and childbirth were particularly hazardous, with maternal mortality rates that claimed the lives of 1 in every 20 women who attempted to bring children into this harsh industrial world. It was in this environment of smoke, noise, and constant struggle that Elizabeth Hartley had made her life, working 12-hour shifts in the spinning rooms of Hornby Mill while dreaming of the family she hoped to raise with her husband Thomas. Their story would become one of the most haunting medical mysteries of the Victorian era, a tale of hope transformed into horror through the cruel caprice of human biology. Elizabeth Hartley had been born Elizabeth Mills in 1816, the daughter of a handloom weaver whose traditional craft was being steadily displaced by the mechanical looms of the new factories. She had grown up in a small cottage on the outskirts of Blackburn, watching as the fields of her childhood were gradually consumed by the expanding industrial complex that would define her adult life. At 18, she had married Thomas Hartley, a skilled mechanic who maintained the steam engines that powered the cotton mills, and together they had established a modest household in one of the newer terraced rows near the town centre. Elizabeth's work at Hornby Mill involved tending the spinning frames, massive machines that transformed raw cotton into thread through a process that required constant attention and quick reflexes. The work was dangerous. Workers regularly suffered injuries from moving machinery, and the cotton dust that filled the air caused respiratory problems that shortened many lives. Yet Elizabeth was considered fortunate to have such employment, as mill work provided a steady income that allowed her and Thomas to dream of eventual prosperity and the children they hoped would improve upon their circumstances. The couple had been married for 10 years when, in the early months of 1844, Elizabeth began to experience the symptoms that she and Thomas joyfully interpreted as the beginning of their first pregnancy. Her monthly courses ceased, her breasts became tender and swollen, and her abdomen began to show the subtle rounding that marked the early stages of gestation. The local midwife, Mrs. Sarah Blackwood, confirmed their hopes after a careful examination, declaring that Elizabeth was indeed with child and could expect to deliver sometime in the autumn. Elizabeth's pregnancy progressed normally through the first few months. She experienced the morning sickness that was considered a positive sign of a healthy pregnancy, and her appetite increased as her body began to demand additional nutrition for the growing child. Thomas was solicitous and protective, insisting that Elizabeth reduce her hours at the mill and avoid the heaviest work, though economic necessity prevented her from stopping work entirely. However, as the summer of 1844 progressed, Elizabeth's pregnancy began to deviate from the normal pattern in subtle but increasingly troubling ways. While her abdomen continued to grow and harden, she never felt the quickening, the first movements of the fetus, that typically occurred around the 4th or 5th month of pregnancy. Mrs. Blackwood assured her that some women simply carried their babies differently, and that the absence of movement was not necessarily cause for concern. More disturbing was the unusual hardness of Elizabeth's abdomen. Rather than the soft, yielding quality that characterized most pregnancies, her belly felt rigid and unyielding to the touch, as if the child within had somehow solidified. When Mrs. Blackwood attempted to palpate the fetus to determine its position, she found herself unable to distinguish the normal landmarks, the head, back, and limbs that should have been easily identifiable by the 7th month of pregnancy. As autumn arrived and passed without any sign of impending labor, Elizabeth and Thomas began to worry that something was seriously wrong. Mrs. Blackwood consulted with other midwives in the area, and together they developed various theories to explain the delayed birth. Some suggested that Elizabeth was carrying twins and that the pregnancy would naturally last longer than normal. Others proposed that she was experiencing a false pregnancy, brought on by her intense desire for children, though this theory failed to explain the obvious physical changes in her body. The winter of 1844 passed without resolution, and Elizabeth's condition became a source of fascination and concern throughout their neighborhood. Her abdomen remained distended and hard, showing no signs of the softening that typically preceded labor. She experienced no contractions, no breaking of waters, no descent of the fetus into the birth canal, none of the signs that would indicate an approaching delivery. Yet she continued to feel pregnant, with persistent nausea and the continued absence of her monthly courses. By the spring of 1845, a full year after the pregnancy had begun, Elizabeth's case had attracted the attention of Dr. William Ashworth, one of Blackburn's few qualified physicians. Dr. Ashworth had trained at Edinburgh Medical School and had experience with complicated pregnancies, though he had never encountered a case quite like Elizabeth's. His examination revealed a hard, immobile mass in her abdomen that felt more like a tumor than a living fetus. Dr. Ashworth's medical knowledge, while advanced for the time, was limited by the diagnostic tools available in the 1840s. He could not see inside Elizabeth's body, could not measure fetal heart tones, and had no way to determine whether the mass in her abdomen contained a living child or something else entirely. His tentative diagnosis was an abdominal tumor, possibly ovarian in origin, though he admitted to Thomas that he had never seen a growth that so closely mimicked pregnancy. The physician recommended that Elizabeth be taken to Manchester Royal Infirmary, where more experienced doctors might be able to provide a definitive diagnosis and treatment. However, The cost of such a journey, combined with the loss of income that would result from Elizabeth's absence from the mill, made this option financially impossible for the Hartley family. They were forced to continue living with the mystery of Elizabeth's condition, hoping that time would eventually provide answers. As 1845 progressed into 1846, Elizabeth's life took on a strange, suspended quality. She continued to work at the mill, though her distended abdomen made many tasks difficult and drew curious stares from her fellow workers. The hardness in her belly seemed to increase rather than diminish, and she began to experience a persistent aching pain that radiated from her abdomen into her back and legs. The mass appeared to be growing heavier, affecting her posture and gait in ways that made her daily activities increasingly challenging. Thomas watched his wife's condition with growing despair and frustration. The woman he had married was disappearing before his eyes, replaced by someone who carried an inexplicable burden that seemed to be slowly consuming her vitality. Elizabeth's appetite decreased, her sleep became fitful and interrupted, and she began to lose weight everywhere except in her abdomen, which remained grotesquely swollen and hard. The couple's relationship suffered under the strain of Elizabeth's mysterious condition. The joy and anticipation that had marked the early months of her supposed pregnancy had long since given way to anxiety and despair. They rarely spoke of the baby anymore, though both continued to harbor secret hopes that somehow, miraculously, Elizabeth would eventually deliver a healthy child who would justify the years of waiting and suffering. Local opinion about Elizabeth's condition varied widely. Some neighbors whispered that she was the victim of a curse, punishment for some unknown sin that had prevented her from delivering her child naturally. Others suggested that she was malingering, pretending to be pregnant to avoid work or gain sympathy. A few of the older women in the community claimed to have heard of similar cases, though none could provide specific details or suggest effective treatments. Mrs. Blackwood, the midwife who had originally confirmed Elizabeth's pregnancy, remained baffled by the case. She had attended hundreds of births during her career and had never encountered anything like Elizabeth's condition. The midwife began to suspect that the mass in Elizabeth's abdomen was not a normal pregnancy at all, but rather some kind of monstrous growth that had somehow mimicked the early signs of gestation. As 1847 dawned, Elizabeth's condition had become a source of local legend. Stories about the woman who had been pregnant for 3 years spread throughout Blackburn and the surrounding mill towns, with each retelling adding new details and embellishments. Some claimed that Elizabeth's baby was actually a demon that refused to be born, while others suggested that she carried a child who had been blessed with eternal life and would never need to enter the world. The reality of Elizabeth's daily existence was far less dramatic, but infinitely more tragic. The constant weight and pressure in her abdomen had begun to affect her internal organs, causing digestive problems and making it difficult for her to eat adequate amounts of food. Her skin had taken on a yellowish pallor, and she frequently complained of fatigue that made even simple household tasks exhausting. Thomas had largely given up hope that his wife would ever recover from her mysterious condition. He continued to work at the mill and care for Elizabeth as best he could, but the financial strain of supporting a wife who could work only intermittently was taking its toll on their modest household. He had begun to consider the possibility that Elizabeth might die from whatever was growing inside her, a thought that filled him with both grief and, shamefully, a kind of relief. The harsh winter of 1847-1848 brought new challenges to the Hartley household. Coal was expensive, food was scarce due to poor harvests, and Elizabeth's weakened condition made her particularly susceptible to the respiratory infections that plagued the mill towns during the cold months. She developed a persistent cough that seemed to emanate from deep within her chest, and her already limited appetite decreased further as she struggled to keep down even the simplest foods. It was during this difficult period that typhoid fever arrived in Blackburn, carried by contaminated water supplies and spread rapidly through the overcrowded working-class neighborhoods. The disease, which caused high fever, severe diarrhea, and often death within a matter of days, struck the poor and malnourished with particular severity. Elizabeth, already weakened by 4 years of carrying her mysterious burden, proved especially vulnerable to the infection. The first symptoms of typhoid appeared in early March 1848, beginning with a fever that Elizabeth initially attributed to her persistent cough. However, within days, her condition deteriorated rapidly as the characteristic rose-colored rash appeared on her chest and abdomen, and severe diarrhea left her dehydrated and delirious. Thomas summoned Dr. Ashworth, but the physician could offer little beyond palliative care, and the grim observation that Elizabeth's mysterious abdominal condition had likely compromised her ability to fight the infection. Elizabeth's final week was marked by periods of delirium interspersed with moments of heartbreaking clarity. During her lucid intervals, she repeatedly asked Thomas about the baby, wondering aloud why her child had never been born and whether she had somehow failed as a mother. Her final words, whispered on the evening of March 18, 1848, were a question that would haunt Thomas for the rest of his life. Why wouldn't my baby come to me? Elizabeth Hartley died just after midnight on March 19, 1848, 4 years and 2 months after the beginning of her mysterious pregnancy. Her death certificate, signed by Dr. Ashworth, listed typhoid fever as the immediate cause of death, though the physician noted the presence of an abdominal mass of unknown origin that had likely contributed to her demise. The decision to perform an autopsy was made by Dr. Ashworth in consultation with colleagues at Manchester Royal Infirmary, who had become interested in Elizabeth's case through correspondence with the Blackburn physician. The procedure was scheduled to take place at the infirmary, where more advanced facilities and experienced pathologists would be available to investigate the mysterious mass that had defined the last years of Elizabeth's life. The autopsy was conducted on March 21, 1848, by Dr. James Morrison, the chief pathologist at Manchester Royal Infirmary, assisted by Dr. Ashworth and several medical students who had been invited to observe what was expected to be an unusual case. The examination began with a careful external inspection of Elizabeth's body, which revealed the obvious distension of her abdomen and the yellowish discoloration of her skin that had marked her final months. When Dr. Morrison opened Elizabeth's abdominal cavity, he immediately encountered something that defied his 30 years of medical experience. Instead of the tumor or cystic mass that he had expected to find, he discovered what appeared to be a fully formed human fetus, but one that had been transformed into something resembling stone. The fetus, weighing nearly 9 pounds and measuring approximately 18 inches in length, was encased in a thick shell of calcium deposits that had given it the appearance and texture of a grotesque sculpture. The calcified fetus was located in Elizabeth's abdominal cavity, outside of her uterus, indicating that she had experienced an ectopic pregnancy, a condition in which the fertilized egg implants somewhere other than the uterine wall. In Elizabeth's case, the pregnancy had developed in her abdominal cavity, where the fetus had grown for several months before dying, likely due to inadequate blood supply or some other developmental complication. What made Elizabeth's case extraordinary was her body's response to the dead fetus. Rather than reabsorbing the tissue or developing an infection that would have killed her quickly, her immune system had essentially mummified the remains by depositing layers of calcium phosphate and calcium carbonate around the dead tissue. This process, known as lithopedion formation, had gradually transformed the fetus into a stone-like mass that could persist indefinitely within the body. Dr. Morrison's careful examination revealed that the calcified fetus was anatomically complete, with recognizable features including a fully formed skull, limbs, and torso. The calcium deposits had preserved the fetal remains in remarkable detail, creating what was essentially a fossil of Elizabeth's unborn child. The pathologist estimated that the fetus had died sometime during the 6th or 7th month of pregnancy, and that the calcification process had taken place gradually over the subsequent 3.5 years. The discovery of Elizabeth's lithopedion sent shockwaves through the British medical community. Dr. Morrison's detailed report of the case was published in The Lancet and was quickly reprinted in medical journals throughout Europe and America. The case was presented at medical conferences and became a subject of intense study and debate among physicians and anatomists who were fascinated by the biological processes that had created such an extraordinary preservation. The calcified fetus was carefully preserved and became part of the pathological collection at Manchester Royal Infirmary, where it was studied by researchers for decades. The specimen provided valuable insights into the process of lithopedion formation and helped medical scientists better understand the body's response to ectopic pregnancy and fetal death. Elizabeth's case also highlighted the tragic inadequacy of medical care available to working-class women in industrial England. Had she lived in a later era with access to modern diagnostic techniques, her ectopic pregnancy would have been detected and treated before the fetus died and began to calcify. The 4 years of suffering she endured were the direct result of medical ignorance and social inequality that prevented her from receiving appropriate care. The discovery raised troubling questions about how many other women might have lived and died with similar conditions that remained undiagnosed. Dr. Morrison's subsequent research into historical medical records revealed several cases of women who had experienced prolonged pregnancies that never resulted in live births, suggesting that lithopedion formation might be more common than previously believed. Thomas Hartley was devastated by the revelation of what his wife had carried for so many years. The knowledge that Elizabeth had indeed been pregnant and that their child had died and been transformed into stone within her body filled him with a grief that was almost unbearable. He struggled to understand how such a thing was possible and whether there was anything he could have done to save both his wife and their unborn child. The local community's reaction to the autopsy findings was mixed. Some saw the discovery as confirmation of the supernatural theories that had surrounded Elizabeth's case, viewing the stone baby as evidence of divine punishment or demonic influence. Others were simply horrified by the biological reality of what had occurred, struggling to comprehend how a woman's body could transform a dead child into stone. Mrs. Blackwood, the midwife who had attended Elizabeth throughout her ordeal, was particularly affected by the revelation. She had delivered hundreds of babies during her career and had always prided herself on her ability to diagnose and treat pregnancy-related complications. The knowledge that she had been unable to recognize Elizabeth's ectopic pregnancy and that her patient had suffered for years as a result led her to question her own competence and eventually to retire from midwifery. Modern medical science now understands lithopedion formation as an extremely rare complication of ectopic pregnancy, occurring in fewer than 1 in 10 million pregnancies. The condition requires a specific set of circumstances. The fetus must survive long enough to reach a significant size. It must die in a location where it cannot be expelled from the body, and the mother's immune system must respond by calcifying rather than reabsorbing the tissue. Contemporary obstetricians recognize that Elizabeth's case would be easily diagnosed and treated today through ultrasound examination, which would have revealed the ectopic pregnancy within weeks of conception. Modern surgical techniques would have allowed for the safe removal of the ectopic pregnancy, preventing the fetal death and subsequent calcification that caused Elizabeth so much suffering. The development of antibiotics and improved surgical techniques has also made it possible to treat lithopedion cases that do occur, though the condition remains so rare that most physicians will never encounter it during their careers. When lithopedians are discovered today, they are typically removed surgically, though some patients who are asymptomatic may choose to leave them in place if the risks of surgery outweigh the benefits of removal. Elizabeth's case contributed significantly to the understanding of ectopic pregnancy and its complications, helping to establish the medical knowledge that has prevented countless women from experiencing similar tragedies. Her suffering was not in vain, as the detailed documentation of her condition provided valuable insights that have improved obstetric care for generations of women. The ethical implications of Elizabeth's case continue to resonate in modern medicine. Her story highlights the importance of accessible healthcare and the tragic consequences that can result when economic inequality prevents patients from receiving appropriate medical attention. The 4 years she spent carrying her stone baby serve as a reminder of the human cost of medical ignorance and social injustice. Elizabeth Hartley's tragic case reminds us that the human body is capable of extraordinary responses to trauma and loss, sometimes transforming grief into mineral and hope into stone. Her story stands as a testament to the resilience of the human spirit and the tragic consequences of inadequate medical care for society's most vulnerable members. The mill worker who carried a stone baby for 4 years teaches us that the body's attempts to preserve and protect can sometimes create their own forms of suffering, and that the boundaries between life and death are more complex than we might imagine. In the archives of Manchester Royal Infirmary, her case remains a landmark in obstetric pathology, a reminder that medicine's greatest advances often emerge from the most heartbreaking human tragedies. Next time, we'll explore a case that challenged Victorian understanding of human consciousness, a patient whose condition would force physicians to reconsider everything they thought they knew about the relationship between mind and body, leading to discoveries that would revolutionize neurology forever. If you found Elizabeth's journey as compelling as I did, consider subscribing to witness more extraordinary cases from medicine's most mysterious chapters. Each week, we delve deeper into the archives, where human biology meets the impossible, where tragedy transforms into scientific discovery, and where the past reveals its most closely guarded secrets. Until then, remember that within each of us lies the potential for the extraordinary, sometimes beautiful, sometimes tragic, but always profoundly human in its complexity and mystery.